Dr. Manjiri Somashekhar, lead pediatric surgeon at Aster Hospitals, Bangalore. 29th of December is observed as National Pediatric Surgery Day in our country. This year the theme is dealing with urinary tract complications or problems in children. So what does this include? This includes problems or swellings in the kidney, the urinary tract infections, external genital problems like abnormal shape, size, or any infections happening in them, undescended testes, swelling in the groin, testicular swelling, any emergency problems happening in urinary tract of the child. So these problems should be identified at correct time and addressed and taken help from a pediatric surgeon. Malignancies involving the urinary tract in children. So, do children get cancer? Yes, they do, as early as the age of 1 or 2 years. And the most common is a Wilms tumor, which arises from the kidney. The child may not have any complaint, but the caregiver or the parent needs to observe while giving birth that any lump is palpable in the tummy. Any abnormal lump in the tummy needs to be addressed and needs to be diagnosed with the help of ultrasound or CT scan. And if it turns out to be a tumor, it is curable, but it needs to be handled with care by the oncologist and a pediatric surgeon teamed up together. Another cancer is rhabdomyosarcoma, which can involve the bladder or the prostate. That also can be treated if it is diagnosed as early as 2 years. We get the symptoms of obstruction or recurrent urinary tract obstruction can be there, or recurrent urinary tract infections can be there. You might find blood in the urine all of a sudden without any other symptoms. So this points at the abnormal kind of behavior of the child. Third one is the sacrococcygeal teratoma. As a rule, the teratoma should be found at the tailbone of the baby, usually at the birth. But there is certain types which are not seen on the surface. It will be developing inside the pelvis behind the bladder, and all of a sudden baby will stop passing stools and urine. There will be a kind of obstruction if the tumor grows to a significant large size. So this again needs to be addressed appropriately by doing surgery, by giving chemotherapy, by different tests. So that is also again addressed by a pediatric surgeon. If it's a malignancy, then it can be dealt with in cooperation with the pediatric hemato-oncologist as well. If you observe any of the symptoms in your child, please do contact the nearest pediatric surgeon in your vicinity for further management. Pediatric Surgery Day is observed once in a year on a particular day, that is 29th of December, by the Indian Association of Pediatric Surgeons, to spread a word and awareness about availability and treatability of certain problems in the children by a pediatric surgery community. Thank you.